Dr. Tracy Tyson, I'm a board certified general pediatrician. I just finished up newborn clinic and I wanted to talk about something that keeps coming up with my patients as well as on the internet. And that is, why do babies need vitamin K? What is the best way to give it? So no, newborns are not born with everything that they need to survive, which is pretty obvious from the fact that 100 years ago, 50% of newborns died in the first few days of life without medical intervention. So one of the things that they're not born with enough of is vitamin K. Vitamin K is an essential vitamin that helps you clot your blood. So I don't know if people realize this, but you are constantly clotting your blood within your body to prevent spontaneous bleeding. So it's not just about clotting your blood from a trauma, but it is from spontaneous constantly, and it is needed in those first few weeks of life to prevent this from happening. So prior to understanding what was happening, babies would have something called hemorrhagic disease of the newborn, where they would have these massive bleeding events inside of their brain, in their body, or they would bleed out from a wound if you just had to do an IV or a blood poke, that babies would have too much bleeding and they would die. And this was a high enough risk that scientists started to look at, why is this happening? And they discovered in the 1920s it was because babies were missing vitamin K. So for decades, they looked at what is the best way can we prevent this? Do we just start treating it when it happens? Initially, that's what they did. When the baby started bleeding, they would give rescue vitamin K. It didn't always work because the damage was already being done. So in the 1960s, they determined that if you gave every baby one single injection of vitamin K into the muscle, it would prevent the bleeding in any baby that it would occur in the newborn period. There's also a second risk of vitamin K deficiency, and that is in 4 to 6 week old babies. They can also have spontaneous bleeding. So you've got two peaks to this, the newborn period, then if you still don't get enough at 4 to 6 weeks, it is there as well. Since the 1960s in the United States and worldwide, we have been giving babies one single injection of vitamin K into their muscle that slowly gets released into their system that allows to prevent the hemorrhagic disease of the newborn at the 4 to 6 weeks. We've been giving it for a long time. I'm almost 50. I had it at birth. It is very safe and effective. There's been long-term studies on this that has not shown any increased risk of cancer or any other complications. So why do we have to give it in injection? Why can't we give it orally? This is a question I keep getting parents asking me. I think parents feel like orally is safer because it's not an injection. And I know nobody wants to cause their newborn any pain. I certainly understand that. But the reason we can't is actually really well studied. It's not because we just want to give the shot, it's because the oral vitamin K doesn't work as well. So what happens is when you give oral vitamin K, so in a liquid, you're guessing how much that baby can absorb. So you're giving a certain amount per kilogram of body weight, and then you're increasing it based on how much more the baby will need, how much they're going to gain. The problem is every baby absorbs differently. Some children did not absorb the oral vitamin K very well, and there were still some breakthrough cases of hemorrhagic disease of the newborn, which is deadly. So even one case that breaks through on the oral vitamin K is too many. So no medical association in the United States or worldwide recommends oral vitamin K. The only time you would see oral vitamin K recommended is if you were in a country where it was not available, or there was some other issue where there was anaphylaxis or something else happened, which I've never seen or heard of. But most reputable newborn doctors are not going to recommend oral vitamin K. I won't write for it. I won't write for it because there is that slight increased risk. There's something that is safe and effective that will prevent all hemorrhagic disease of the newborn. So it's not as effective, it's not safe because of the risk of bleeding. So that's why we don't recommend it. Again, I certainly understand parents wanting a different alternative. It seems like it's safer, and there's a lot of misinformation on the internet. So just understand how long this has been studied. This has been studied extremely aggressively. We have whole generations of people that have been born getting vitamin K, have lived their lives, and have been extremely healthy. I've seen hemorrhagic disease of the newborn in one child in my career, and a baby who did not receive vitamin K was getting oral vitamin K, did not tell the person doing the circumcision that they didn't get the injection, the baby died from the circumcision, they bled out. It was one of the worst things I have ever seen in my career. I would never want anyone to experience that. So again, in public health, one case of a baby dying from something is preventable. We have a safe and effective way to prevent it is too many. So please don't take this risk with your child thinking that it's safer. Ask questions, ask why this is being recommended, if it's being recommended by a different provider. talk to your OBs, talk to your pediatricians, see if we can answer any other questions that come up. The last thing I will mention, and we're going to talk about this really quickly, there is a black box warning on vitamin K, and that gets confusing. It is not for babies for hemorrhagic disease of the newborn. It is for older people who are dying of a stroke and bleeding out. We can sometimes rescue them with high doses of vitamin K. That can be deadly. You wouldn't be doing something that wasn't deadly if you're trying to save someone's life as a last-ditch effort. Again, it is not for newborns. It has nothing to do with the newborn period. It has been proven to be safe and effective. There are very little to absolutely no complications from vitamin K, yet it prevents something that is extremely deadly. It's absolutely horrible to watch. So I hope this video helps a little bit. Again, take everything you see on the internet with a grain of salt. Ask questions. Talk to your healthcare providers. When you have an entire group of people who have had the education, have seen all of these diseases, and they all recommend the same thing, please listen. We want your babies to be safe and healthy. We want us to all work together, but we also want you to have informed consent. So keep asking your hard questions. We are here for it. We want to help, and we can all do this together. Take care.